So this has been there for many years, yeah?
Yeah.
For how many years exactly?
12 years.
Before that?
That when I was in 8th standard, little was there. Then that day surgery.
They did surgery and they removed.
All removed.
Then again it started off.
Yeah.
Oh, usually it doesn't happen like that. When you become 30 and all, it has started after you're 38, is it?
Yeah.
Okay, open your mouth. Yeah, there is a lesion still. The hemangioma is still there. Torch lagao. You can see it's compressible also. Yeah. You have any pain when I do it there? Slight pain is there. Okay, look down. Look down, look down. Okay, close your mouth. Now, you want me to correct just this or you want me to correct this also?
We just want to know, is it really required to get it operated?
Okay.
Even if you get it operated, can we do it through inside?
Yeah, I think I can do it through inside.
We don't want any scar,
Yeah.
It's going to be, so,
But see, she's got loose sagging skin also there,
okay.
which is not looking so nice. Even if I remove from inside, imagine a balloon gets blown up, you remove the air from inside, still there will be some loose skin and all. I can remove from inside, but it's still going to have some loose skin. You want it to look nicer, otherwise you'll do a facelift later on. Remove from inside, then tighten the skin from around the ears. We may not be able to do both at the same time because it's a tumor. And also it's still having some blood flow. It's not a dead.
Correct. Exactly.
Yeah, they have done something and all, but it's not like it's a lesion that is not
We
active.
have got MRI scan.
Yeah, I need MR angio. That's what I need, not normal MRI.
I think it's angio only.
Okay.
They have done it there.
Oh yeah, they've said embolize, intraversional radiation, skull-based extension. This is what they've told you?
Also PD is there.
Okay, venous mouth.
Just recently done it.
When was this done, do you know?
I mean, 2000.
And all of this was done in Bangalore, is it?
No,
No,
no.
no. In Dubai also.
It's in Dubai, Abu Dhabi, as well as this all report. There are more reports.
Which is the current one?
These are the one.
What?
And there is another MRI scan also. Yeah, this one. The latest one.
Yeah, 18th July 2021.
Yeah.
But I think this is MRI and not MR angio. It's MRI contrast and all of that. This is good, but actually when we plan surgery, I don't need it if you are not doing surgery, but if you are planning surgery, I'll need what is called as an MR angio. What MR angio does is it shows all the feeder vessels for the lesion, for the hemangioma. Hemangiomas are usually fed by vessels, and I can press and see that she's having some vessels. So if I know clearly how many feeders there are, then when I'm operating, I can be a little bit more specific and quick and precise. Just go and tie those things up or cauterize it or laser it and then remove the remaining part of the lesion easily. That's why MR angio helps. I need it only for surgery. If you're not planning surgery, I don't need any scans because I can only tell you that see, this is not going to grow.
Do you have any medication for the
No.
medication? You cannot
It will not work with medicines. Surgery is the only solution. Ideally, it should have been solved even when it was done earlier, because you are saying it has grown after 30. That's rare.
Yeah, okay.
So, anyways, still we are having surgery as the only option for curing this. All of these injections and all won't work. It works for some patients who are younger, few months old and then few years old and all that, but once you finish growth, they usually don't work.
So it can be get done from inside also. That's
Yes.
a good,
Most likely I should be able to do it from inside.
okay.
But you should give me a consent for outside also. Because see, this is a tumor surgery. This is not a cosmetic surgery. We are trying to go get a tumor. Whatever it is, hemangioma is not a good lesion to have in the mouth which has got big extension. It's better to kill it, better to remove it off. It's not, I mean, it can bleed suddenly. If there is another incident, this will complicate that. It's not something desirable anyways. And you try to do so many things, and that has helped indirectly, meaning it has reduced the flow. This bleomycin and all these injections, what it does is it makes the lesion easier to operate, if you want to put it like that. Most likely I'll be able to solve it inside the mouth, but I have not seen your MR angio yet. So I can't categorically say that yes, I will do it from inside the mouth. I will be able to do it, but maybe you might have to give me a consent that I sometimes make an incision outside or something, because hemangioma is such. This is something you have to understand, and I'll know a precise planning only after I get the MR angio to see the vessels and everything. That's first thing. Secondly, I don't think we need to bother this, because usually when you have here, it also indicates that it goes into the brain, some small vessels. So there is no need to go, and better to leave it alone, because that's a very small swelling. Your MRI itself says that there is some intracranial extension. When I take the angio, I'll get it very clearly. So if there's an intracranial thing, we shouldn't go nearby and try to do something for cosmetic reasons. This of course is far, it's in a different way. I can correctly get vessels all around it, and then I can just take it out. But here, if it's diffuse, this could be a vessel from here going into the brain and all of that. It might be difficult to, so leave that alone. This is sure.
If you do outside, any complications?
You will just have a small scar, if at all. I'm going to do mostly inside only, but sometimes vessels are nearer outside, means might be difficult for me to go inside and hunt for it. So I'll have to make a small incision and
after that we can do plastic surgery.
It's not going to look bad. It's going to look better than now, even if I make an incision. Don't worry about that. Otherwise, why are we doing this? It's going to look 10 times better than now, surely. Any incision outside doesn't mean bad scars also, right? It's not like that. It's just an approach for me to reach this.
So you will cut and lift it up from here and take the tumor out? Or
The plan as of now is from inside the mouth only.
okay.
But I need to see the MR angio and everything. In case I might put a small nick here, one nick here, like 1 centimeter stuff here and there, to just go and localize things like that. I do use sometimes that way, depending on what I see on the scans and how the bleeding is and everything.
So MR is available nearby?
Yeah, we can take it nearby if you want me to take it.
Okay. Here is that.
No, we don't have it at our hospital. We have to go outside to a.
See, the thing is that we want to do as many things as we can today.
Okay.
So if you allow us to do and return back to you, we are more than happy.
Yeah, but actually this much is enough. The next step you need to do only if you're planning surgery. I don't need to see MR angio for anything. It's only if you don't have time or don't have intention, I can give you all information about the surgery. Exactly how I will do, only I will need the scans. But otherwise the scan is a waste of your money and time and exposure unless you're planning surgery. 14,000-15,000 it will cost you. It's not the money alone. It's just that you have to go there, wait for what? Because if you come after 6 months, again I'll say, Pinay, I want one more MR angio. Valid only for 6 months.
So you suggest the scanning before the surgery?
Yeah, I want it only before the surgery.
Yeah.
So let's say you decide, now you have a consult. I've told you everything. We can get rid of the swelling, mostly from inside the mouth, maybe from outside. You're looking at about 7 days stay here, or 5 days at least. It's not going to get done in a day or two, because hemangioma swells up after surgery. Sometimes, okay, there may not be anything, but I'm going to be telling you the worst scenario. So we have to plan for a week, 5 days at least, and maybe some review also after that if possible. If you cannot come back for review, plan 10 days. So I'll send you once and for all, and you don't have to come back. So that's the time period you're looking at. Costing, my executive can tell you a range. So then you decide when you want it. Then we can take the scan, and her diabetic status and everything, that should be under control. We will not do this procedure if the sugar is high or it's not under control. And then when we have time, we can get the scan and do it. That's easier because you already have a lot of investigations. This gives me a very good idea of what I'm going to deal with. The angio is really good. You will see when you get the films, they'll show the blood vessels like snakes crawling onto the lesion, and the lesion, the size of it and all of it.
This, what do you call it, that CD will not help you?
Because you've taken MRI.
Exactly.
Yeah, it's not that it will not help me, but all the other information I already have.
Yeah, okay.
They've mentioned on the report, and they've said, we don't need embolization and all. Don't worry about that. So they have suggested embolization because there is a feeder. Embolization is to block that. So you can also tie it. Other way of embolization.
Injections we have like embolization 3 times.
Correct. So that's why when I feel it, there is some fibrosis, some scarring, and the flow is not rapid. That's so good things. It makes surgical excision that much more easier.
Before surgery, is it not good to have more embolization?
No, I don't need anything.
Okay, I mean this we are basically we are this one we are taking.
Yeah, many surgeons will ask for all these
yes.
things because they are not
This also I heard from
confident. I do a lot of hemangiomas. I'll not need another. Nothing will be needed.
Okay, that's fine. I heard you are visiting abroad also, right?
Yeah, but I will not be able to do this procedure in Muscat.
You are coming Muscat only. Or where? See or where?
Yeah, see, in Star Care.
Okay, start
I can do, but see, I'll be there only for 3 days.
Okay. Then no follow up and this and
Follow-up doctors are there, but see, hemangioma is something most of them
no problem. Then
wouldn't want to do.
Doesn't matter. We will get it done here itself.
Yeah, decide when you want it, and first is that.
Yeah.
Then after that, we can work the scan 1 or 2 days before. That's enough for me. And then I'll tell you the details. And we can
The
proceed.
biggest respite for us is at least we know that it's treatable and you can do it.
That is done. Already I've told you that.
Yeah, that is
I
the
don't
most
need the
important.
MRI angio for that.
True. That's the most important.
Yeah,
Because we
that
know-
is done. That is straight
We
away.
consult a lot of doctors,
Okay.
here and there. Somebody was misleading us, and once you cut here.
Oh, I do much bigger ones than these.
Because there is some chances to have some D-shape forming and that. Lot of things people.
I don't think you need to be worrying of that. The only thing is because it's recurred at that late age, so maybe you will not get 100% result.
Okay.
That means exact symmetry.
Okay.
But definitely there's going to be a huge improvement from where she is right now. So that's still a
Good. Yes.
big direction in the right path.
Like a medication, there is nothing to subside, nothing is there as it. Till we come back, maybe it can.
Just leave her alone.
Okay.
Nothing needs to be done. It's only going to work.
Yeah. This, if you don't mind, can you give me this scan in writing? Maybe I can get it done there and by before coming.
Yeah, they can do that.
Yeah. Just give me.
Hey, मैं एक लेटर पैट दो ना.
Yeah. And then if you don't mind, can I have your card also? Yeah. This is my cousin, he was in communication with you.
Oh, okay.
So
His family, just small kids are there in the hotel, we need to check out. That's why we are
this is the most important one. Other things can wait. So thank you for letting us, Doctor.
No. Sorry, I got delayed because
Yeah, we understand.
we had a little difficult case and so got delayed.
No problem.
Meeting you was the most important part of our trip.
Yeah, that is no.
And you've come all the way from Dubai now or from Kerala?
No.
Okay.
Kerala.
Of course, we have patient care.
Sure.
Yeah.
So it's called MRI angiogram. MRI angio.
So we'll book it. How far, I mean, how many, before early we need to book worker in case we are coming to this. Most probably we have holidays there,
May.
holidays.
May.
May.
First week.
You will be available at that time?
Yeah, May you can book now itself.
Okay.
Because we do get booked out. Yeah, so you can take. They're better to take an appointment. It's easier.
Oh,
No, like we have to count the days, when it's coming. Okay, from there I can book it.
Yeah, you can. I'll tell you
After
the.
about 3 days.
Yeah,
I will
you can.
find- yeah.
Better to book before rather than just come and
Correct.
take appointment, because it's not a very small procedure. I have to plan.
Yeah.
Usually in the morning, you got to get the blood ready. All those things we will do.
okay.
So it takes a few hours of planning and all of that. And she's diabetic, so we need to get the ECG. Finally, physician will say take echo. All the drama will happen, because they will do all the required things. Then anesthetist will, so everything. It might take a day, all of that.
It's what you call the anesthesia. How you are going to do it? It's a locally or
No, general anesthesia. She will sleep. You can't do this under local and all.
where the back? or-
No, here through the mouth we'll put a tube.
And we can have our stay over here, right?
You have to stay here, surely. Yes, at least for 4 days minimum, maybe 5. Because it swells up usually. Even though you ligate and cut it, it swells up.
So you will admit her here.
Yes.
Okay. So I can stay with her.
You can stay with her, correct.
Is there a chance of recurring after the procedure? Is there a chance? Any
Most likely no, but maybe there is one chance I may not, like I said, get a full 100% symmetry. So
That's fine.
I don't think it should recur.
Yeah.
Don't think it should recur.